Welcome back to another version of Back to Back. This is Dr. Mark Moran, and we are here again to try and help you empower yourself with knowledge and education about what you can do to help prevent pain and live a happy, healthy life. My two guests today, they lost a bet and they had to come on the show. One of them is my brother, the other one is my other brother. I would like to welcome my two favorite brothers.
That's good.
Dr. Scott Moran.
That's me.
And Mike Moran.
He doesn't have a doctorate.
Spirit hands. He does have spirit hands, though.
Yes.
Which one's more important, spirit hands or doctor?
Spirit hands take you so much further.
I think spirit hands would be very important.
This is why my hair is thinning. This right here.
Okay, so we're going to have a lot of fun. We're going to teach you guys. Hopefully you'll learn something, and we will make sure that this is worthwhile enterprise. Okay, so both of you guys are highly, highly educated, and you're the leaders in your field. So Scott's a PhD. Mike just got National Salesman of the Year. Congratulations.
Thank you.
So I talked to mom and dad before coming on here, and they clearly said I was their favorite.
Our mom and dad.
Yeah.
The three of us.
They clearly said I was the favorite, but they said, who do you think is your second favorite? Now, who do you think they said?
Was mom drunk?
Was she drinking?
Do you have to ask that question? She definitely was drunk.
I know the answer, but I think it would offend some.
What do you think, Scott?
What do I think about what again?
I said, who do you think mom and dad said was their favorite?
I think mom said, I love you all equally. I think dad didn't understand the question.
Dad didn't hear, and mom said that exactly the same. Okay, good answer. Okay, next question as we start to learn about our guest today is, what is your superpower? Go.
Ooh. Why am I first?
Because I pointed to you first.
Okay, that's a good point. Get it? A good point.
Uh-huh.
My superpower. I am able to discern when something is wrong with people, even when they're trying to pretend like there isn't.
So, good intuition.
Yes.
Okay, what's your superpower?
Do you have to do this when you talk?
I don't stab my salad when I eat it, like you.
What is your superpower?
I just scoop it up and eat it. You stab your salad like it has to be killed.
Lettuce isn't going anywhere.
Let us continue.
Yes, thank you. Mike, what is your superpower? I think your superpower is the ability to get people to do things they don't want to do because you're sales.
You just did. You just answered my question.
See? Perfect. Okay, now to get to the real question, I wanted something more fun is if you could have any superpower, what would you have? Mike first.
I already know.
I'd love you to be able to be Stretch Armstrong.
You want to be Stretchy Elastic Man?
Yeah, elastic.
I understand that because I know what it's like to be tall. You don't. Scott, what's your superpower you would like to be?
Well, now you made me think. Because tall sounds good. I've only ever been
Short.
Vertically challenged.
Yes.
No, I think I would want to be able to predict the future.
That's a good superpower.
Mm-hmm.
That's a good superpower.
And that way,
Oh, gosh.
I could anticipate the questions that you guys pose that are ridiculous and have an answer for them ready to go.
If you had that superpower and you were an audience member out there, hello to all y'all. Thank you for being here.
All three people you're saying hi to right now.
Yeah, well, there's three of us here, so at least three.
No, I've been on TV before.
If you could have the superpower to see the future, how is this going to be received? Positively or negatively?
Assuming they edit you out, his likes are going to go cha-ching.
They're going to go cha-ching.
Mhm.
So you may get 6.
I'm hoping to break double digits.
That would be impressive.
Double digits is what I want. Okay, so first we're going to talk about educators. So teachers in Texas, our mom's a teacher, Scott's a teacher. He's got decades of experience. And we grew up going to public schools. We went to Clark. We went to Hobby. Went to Adams Hill.
I played football at Hobby and Clark.
You played football at Hobby and Clark. That has been verified.
Mm-hmm.
We did have verification of that.
Well, I was on the team.
Okay,
Thank
okay,
you.
that's
Thank
okay.
you. I'll picture it. It was
so
a clean jersey.
take a guess. Whoever's closer is going to win. How many teachers are in the state of Texas? Within 2.
Sorry, I gotta get rid of that. How many teachers
are in the state of Texas?
are in the, am I supposed to be talking as loud as you?
I'm just talking into my mic.
All right, I'm just checking. How many teachers are there in the state of Texas?
Yes.
Not enough. We are in the middle of a teacher shortage.
You're correct, but how many? Just take a guess. It's really just a fun game.
It's really just an answer.
60,000.
60,000 in Texas. What do you think?
That's a bad number.
I'd rather come in under than over.
Yeah.
So now the pressure's on you.
No, I would say 90,000.
In Texas, there's about 390,000 teachers.
See, I said 390,000, but the 300 part got cut off.
Yeah. What percentage is female versus male?
I'm going 72.
What do you think?
Female?
Mm-hmm.
I would say 87.
It's about 75. Okay, so what percentage do you think have back pain?
What is 40% of 300?
I'm not asking for a number.
Percentage.
What percentage?
It's not a hard game.
Yeah, it's pretty simple.
70%.
It's not that much.
What do you think?
Let's say 42%.
It's about 63%.
Okay.
About 63% of teachers have low back pain.
Wow.
And what's the main cause of low back pain in the work-related industry?
Leaning over on your computer.
Wrong.
What do you think?
Sedentary lifestyle.
Both of you guys are right. Ding, 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 ding.
I get a full point here.
It's about ergonomics.
Ergonomics.
Unfortunately,
Do you know what that word means? Okay.
many teachers are standing or sitting a long time, and that itself causes low back pain. It's not doing a bunch of heavy lifting. It's not exercising too much. It's not doing all
leaning
sorts of
over your computer, like you said. It's
ergonomic factors.
2-to-1.
A lot of teachers have to do that to get their work done. There is a shortage of teachers, which is really a travesty because teachers are investing in our future. What are the biggest problems you see with teaching right now?
Back pain wise?
No, just biggest problems.
Generally speaking.
Yeah.
In addition to the teacher shortage,
Yep.
we're having quite a few teachers become teachers after they go through alternative certification, which means that they don't student teach. And I'm not really sure about the quality of the education
Okay.
program.
Okay.
That's 2. And then 3 is there seems to be a propensity or a tendency for people to want to teach all the kids in the exact same way, in the exact same manner, regardless of how the students learn.
Different students learn different ways.
Differentiation.
So let me consolidate your answers. So work-related stress, absolutely. Poor teacher quality or not optimal education, absolutely is a concern. Health-related mental problems, not only for the teachers, but the students.
Yes.
Low pay.
Yes.
I understand that it's a significant problem for teachers to be at work and at their utmost health. And then consequently, there's downstream effects where the education suffers.
Correct.
Right. Okay. So how are we going to fix these problems to make sure we can optimize teachers' health?
Well, based on what I've learned so far, having worked with you, Dr. Moran, is I've learned.
You can just call me Mark.
Okay. I mean, whatever. Alan.
Have you met me?
I'll call you Alan.
You call me whatever
Alan's
you want
his
to call
middle
me.
name. ALAN.
You can call me whatever you want to call me.
All right. So Alan has taught me. I have been in I've experienced a lot of stress in the job. It's a very stressful job. Most people don't realize that until there's an outbreak of a once in a lifetime pandemic, and then they appreciate you until the pandemic's over.
Well, let me ask you a question on that point. How many hours a week do most teachers work?
It's not 40.
What is it?
70 or 80.
It's about 54. It's about 54.
Well, I'm talking about me.
On average, it's 54. And what percentage of time of teachers' work is spent in the school?
The vast majority.
It's about 46%.
Well, that's close to the majority. That's like half.
So the point is, a lot of time teachers are working outside of school that people don't appreciate.
Exactly.
Okay.
Thank you. Appreciate that, Dr. Moran.
Yeah. So a lot of times teachers do a bunch of work at home, whether it's grading papers or reviewing lesson plans
That
or
is
talking
correct.
to parents or whatever. So a significant amount of work is done outside the school. It's not just
Including weekends.
So what is your opinion about one ways we could empower teachers to help them optimize their health so that consequently they could project efficient teaching to their students?
This is what I was getting at earlier before I was cut off.
I was totally interrupting you.
Yes.
Sorry about that.
So let me go
You
ahead
have the
and
mic.
backtrack. What I was going to say is I started working with Dr. Moran, Mark, Alan, whatever you want to call him. And he taught me yoga and dietary changes and things of that nature and I've lost 30 pounds.
But you've done a good job of exercising too. You're exercising a lot more.
Yes, I'm making that a priority.
Right, so that's good.
I didn't used to make that a priority because there was always something to grade. And I've also noticed that my neck pain, my back pain, my hip pain's gone.
So what I'm hearing you say is you've become an active participant in your health.
Yes.
Okay. What do flight attendants tell you when you're on the flight and you're about to take off with oxygen?
They say, please put on the mask yourself before you help your child.
And why do they do that?
Because you are, if something starts going really badly and your first instinct is to take care of your child or kid, right? You can't do that if you don't have oxygen and you're not in a secure, calm place. So if you put it on yourself and you're receiving oxygen and now you're protected and safe, you can there pass on.
I think you didn't put it on right. You have to pull the tabs.
That's right.
Yeah.
So essentially what we're saying is you have to take care of yourself first so you can help others.
That's
and
correct.
teachers a lot of times don't do that.
Yeah.
A lot of times they put their students first or their classroom first or their lesson plans first or the parents first. They do all kinds of other things to take care of other things besides themselves, and consequently they're not optimized for teaching.
I 100% agree with that. And I lived that life all the way through earning my PhD. So that I was going to work, prioritizing the kids, coming straight home, sitting over a computer for 3-4 hours a night, and prioritizing that. And there was no exercise for a span of 3 years.
I remember.
And I put on weight, and my pains that I mentioned earlier were a major issue.
So you have to be an active participant instead of a passive recipient.
He already
That's right.
said that.
Well, he said that 10 times.
I don't need you to
from him.
repeat it.
I learned that from him. So when did you become intentional? What was the aha moment for you after you just described what was going on for 3 years that you said, hey, I'm going to go to a yoga class with Marco? Like, what was the aha moment that became the intentionality for you to change your life and be proactive?
Is intentionality a word?
It is now.
Isn't it? Okay.
I remember, I don't know how long ago it was. I guess it was 2 summers ago. I just remember thinking, well, I happened to walk by my graduation picture when I got my PhD, and my face was all swollen and everything else. And it still was because I wasn't living a healthy lifestyle. So I just made a conscious decision to start walking. I started with walking 2 miles, 4 miles, 6 miles, 8 miles, 10 miles. And then I noticed I was feeling better, more awake, more able to handle stress. And then I started going back to the gym. I hadn't been since COVID, and I liked it a lot. And then I started doing yoga, and it just continued from there.
So if you could go back and tell 35-year-old Scott,
This 35-year-old Scott had hair.
He did?
That was only 5 years ago.
If you could go back, what would be the number one priority you could change to prevent all these problems?
I would say eat healthy and take care of yourself and exercise and make yourself a priority, because I've never done that well until recently. I've always put everybody else first.
You're exactly right. That is the main lesson here, is that we have to try and get people to empower themselves so that they don't get to the point, not to be disrespectful, where you were, and then you had to use all these years where you weren't being healthy and suffering with pain and consequences of not being healthy, and then consequently it drags out. So I agree with you. If you could go back and tell yourself what the priority is, it's be an active participant in your health. Eat healthy, exercise, take care of yourself. Do yoga, like you said, is very important. And all these little things will help maximize your health, consequently minimize your health care expenses, because a lot of teachers don't make a lot of money. So they, a lot of times, erroneously think they should not spend money on health, but then they spend money on all these expenses that come with poor health. A lot of times, teachers need to realize they should invest even minimal amounts of money, like shoes, or not buying so much food, or resistance bands, or something where they can just start walking and being healthy, and that in turn will give them a return that they want.
Make sure you buy the right size shoes, because I had the wrong size shoes
I know you
for
did.
2 years. Didn't understand why I had foot pain, and then realized they were too small.
I would add that. I think that's really good stuff. I would add that, first of all, to you and to all the teachers out there, thank you for what you do. Your selfless job is certainly under undernoticed and certainly underpaid. And so we appreciate all what you do. I would tell you that I would add to be truly intentional. I thought about writing a book one time. Did I say all this?
No.
I want to label it live tensional. Because if the word intentional is inside your
chose
living.
not to do that.
Well, I'm still thinking about it.
Okay.
I might do it.
Yeah, so you can't. It's
I'm going to take that
registered.
title.
Yeah, live tensional.
Is that title copyrighted?
Not yet.
Okay, well.
It's on video right now.
It's
I'm
my
going to
show.
go home right now. I'm going to patent that.
It's my show.
It's good. Live
It's my
tensional,
show.
right? And so everything I try to do is intentionally motivated. So I would tell
Why don't you
teachers
just
and
flip it
everybody.
to intentional living.
Because live tensional is one word. It's all about branding. He'll get it one day.
Okay.
But anyway, and so live tensional, but let's call it teacher time, right? And maybe take teacher time for yourself.
Yeah.
Even if it's getting up an hour early or 30 minutes early and go walk down the block one time, take teacher time. Like, no, it's not about the 4 kids I've got to wake up and make breakfast for. It's not about the extra grades that I have to grade. I'm going to take teacher time for myself, and I'm going to be intentional. I'm going to live tensional in that moment.
Put oxygen on yourself first so
Love
you
it.
can take care of others.
That's right.
I agree with that.
Again, you got to pull the straps.
I agree with that. What percentage of teachers are seriously considering leaving teaching?
Oof. Now? Oof.
Well, if you mean based on what you've read on the internet versus reality, I would say based on the internet, it's probably 60%. In reality, it's probably 70%.
I was going to say 65, 70.
It's 70%. So about 7 out of 10 patients. Teachers really are seriously consider leaving, and what is that going to do to the quality of education of our kids? So as we look to try and solve these problems, it is well known, it's well proven that your health is your wealth and personal happiness is tied to your health. Mm-hmm. If we could get teachers to invest in themselves just a little bit, like Mike said, 5, 10, 15 minutes teacher time a day, there would be a snowball effect of becoming healthier. Consequently, personal happiness would be raised, and then there probably would be less likely for them to leave their job.
Yeah, right now we have a quiet room where you can go and sit. There's no exercise equipment in there. It's just to shut the door and tune everyone out. And I don't know that that's healthy.
I love seeing office buildings, things like that, where during the lunch hour, you just see people taking a 10-minute walk.
Yeah.
It's better than nothing, fresh air.
That's great.
Do laps around the campus.
Yeah. There really is no excuse to not doing it. We all have hard days, but there's no excuse, even when I'm tired, don't want to go to the gym or whatever, I'll just go walk.
What percentage of those teachers are going to miss 10 work days every year just from low back pain?
Well, we're only given 8 days off a year, so
Just take a guess, percentage.
18.
What do you think?
18%.
10 days is a lot. So they're lying, right? I mean, obviously they don't have that much PTO. So that's my point, is
No, we just said teachers are out of shape, mentally
they
strained,
don't have that much
don't
PTO.
get paid, aren't exercising.
So they're going to work.
So 18% of them, it's going to impact.
You know what?
18%.
Both of you guys' answers are going to be right. I just need the answer.
I
What
need
percentage?
to say 40%.
It's about 15%.
See, it's 15%.
15% of every workforce in the
I said
country.
18.
Whether it's teachers,
I got that
whether
right.
it's
No, you didn't
firemen,
say every
whether it's
workforce.
people
You
working.
said people in Northside.
I said every workforce in the country, about 15% of them will miss 10 work days a year from low back pain. Northside has 20,000 teachers.
See, that's
so
where I got
15% of
confused.
20,000 is what?
15% of 20,000?
Is what?
I wasn't told there'd be math. I'm an English teacher.
What's 10% of 20,000?
Well, 10% of 20,000 is
2,000 plus
2,000.
another
plus
1,000.
another 500-ish. Right?
Plus another 1,000. Everybody, he's an Aggie. Whoop! That didn't go too well for
He's
him.
an
It's
English teacher.
3,000, dude.
Well,
It's about 3,000 workers.
maybe.
Okay, no, that's the statistics. Are missing work for 10 days. So you multiply 3,000 times 10.
That's 30,000.
30,000 work days per year lost because of low
Wait,
back
I'm
pain.
confused. There's only 365 days in a year. So how can there be 30,000?
It's all the teachers. There,
But
if
there's
you
only
listen,
365
listen
days.
to what I'm
You're
saying.
not listening.
I am listening. I'm joking.
You're
I'm not stupid.
There's about 30,000 lost work days a year in Northside. because of low back pain.
Equivalent to.
So then they have to get substitutes.
Yes.
Or they have to get teachers pull from different rooms.
Yes.
Or they have to do other things that minimize the optimization of education.
And essentially anybody with a pulse can be a sub, and they don't often do anything that you leave for them.
Well, I'm sure there's lots of good
With the
subs
kids.
out there. We're going to make sure we're nice.
Okay,
There's
so
lots of
my
good
bad.
subs out there.
There's some good subs out there, but there are also some that don't necessarily follow through with the lesson.
Well, there's lots of good subs out there, but just like subs are, they haven't been trained. They're not used to the system. So, of course, they're not going to be as efficient as a teacher.
Firehouse subs is really good too.
Firehouse subs. Right. The point is, again, to reiterate, it's very important for teachers to learn the lesson you learned after 20 years, to invest in themselves, to be healthy and active and exercise, do yoga, eat healthy, so they can prevent the problems that are coming. And it is not hard to see that these will occur. Okay.
Right.
And usually it's more women than men that have low back pain.
Is there a reason why we're focusing on teachers? Is it just because I'm here? Because I'm concerned about rodeo cowboys.
We're talking
they
about
must
teachers.
have a lot of back pain.
They definitely have a lot of back pain.
Yeah.
I have lots of rodeo
I'm
people
very
that have
concerned
back pain.
about that.
So you're right. We should talk about other things, which is why we're talking about low back pain in general. And that's why we have Mike here. There's lots of different ways to treat back pain. One of the ways I recommend is go to onemonthmd.com. There's lots of education there about learning the causes and treatments and prevention of low back pain, which I highly recommend everyone do because it empowers them. Other things would be medicines, therapies, injections, or surgery.
Gummies.
I take care of medicines. I take care of injections. I take care of therapy, but I refer out for surgeries.
That's true. You have injected me in the butt before, and it helped my pain a lot.
I'm glad that you got benefit.
Mm-hmm.
What percentage of Americans do you think will have back pain?
Will have back pain?
Yeah.
60%?
And you said 40? Mm-hmm. It's about 80. About 80% of Americans are going to have back pain at some point in their life. Man. Okay. Now, a lot of times people have back pain. They try things at home. Then they go to a doctor. They get an MRI. Mm-hmm. What percentage of Americans will have pathology like herniated or bulging discs on an MRI with no symptoms?
80%.
No, it's probably up. It's not the same.
I'm just...
He's just taking a guess.
Yeah.
I was going to say 60.
It's about 35.
Okay, so 35.
A lot of times patients will go get an MRI and the MRI will show bulging discs with no symptoms. So consequently, we don't end up treating those patients because they don't have symptoms. You don't treat the picture, you treat the patient. Right. On the other hand, a lot of times patients will come in and they have really bad symptoms. We treat them with medicines or therapy first because the
It's a
image
Band-Aid
might not be
approach.
right. Right. Okay. So of the patients that do have significant symptomatic herniations or bulging discs, we try medicines, we try injections, and one of the things we try to prevent is re-herniations of discs. For patients that do have symptomatic herniations and we do injections and their symptoms get better, what percentage re-herniate?
Very high.
The data shows 5 to 15%.
It's right. It's about 10%. This is Mike's field. This is Mike's field of expertise.
I know this.
He knows this. And Mike was so nice.
Well, I wasn't given any notes or videos to prep with
he
this.
brought some visual aids. So can you explain bulging discs to us, and then we'll kind of transition into barricade.
This is a part of your spine segment. So these are the spinous process. Those little bumps that go down to your back. This is your spine, looking at from the back now. If I turn it to the side, I would be turning sideways. This is one of the vertebral bodies, and in the middle of that, of each two vertebral bodies, is the disc. The disc is a circular function, and it's an outside annulus that has a bunch of jelly stuff in the middle, okay? When a disc hurts, and this allows the loading of the spine as we stand up. We bend forward, we bend back. So a disc herniation, this yellow thing is the spinal cord. A disc herniation occurs when the annulus, the outer covering of the disc, gets really weak, and as the loading occurs, part of the inner part of the disc, the nucleus, can squirt out or be contained and put a bulge on the yellow thing, which is the nerve, which causes pain going down the butt and the back of the leg.
And the classic example of that is donuts, jelly donuts. We tell our patients disc bulges are just like jelly donuts. When you bite a jelly donut, it squirts out backwards.
That's true.
It's the same thing with these. If you put pressure on the front, it's going to squirt out backwards. That's a disc bulge. It's just like biting a jelly donut. And that disc bulge will put pressure on the nerve, and then you will have pain down the nerve.
Does that actually squirt out?
Yeah,
It
that's a
can.
disc bulge.
Like-
It can. Or it can be a contained fragment. It could be a sequestered fragment, meaning it goes out.
I know what sequestered means.
Okay. That's
I know you know what sequestered means.
So that is a disc bulge. So the bulge can be contained, just putting pressure on the nerve. It can actually separate and go back out, and they'll have to go fish it out. But that puts pressure on the nerves, causing pain, symptoms. They'll get an MRI. If Dr. Moran, if the conservative therapy doesn't work, injections, whatever, he may refer to a surgeon for a discectomy. Ectomy means removal of.
Thank you.
Discectomy, removal of that. So the surgeon would go in, take out the bad part of the disc,
The jelly part.
the jelly part, to remove it, decompressing or taking the pressure off of the nerve so the pain goes away.
The pain goes away, but you still have no little bag in between your
Very good. That's good.
the white part.
Well, it's still there. It's just not as much.
Not
Yeah.
much.
It's imagine taking some of the jelly away from the donut. There's still
Right.
some jelly in there.
Right.
You're just taking the piece off
But you
that
have
came out.
less of a cushion from that point on.
You do. And that outer circular part of the donut, now there's a hole there, right?
There's
Because
another
they had
hole
to
in the donut.
you're leaving a hole there, right? Depending on the size of the hole, the data shows that re-herniation rate, now that bad disc has been taken out, there is a hole there. That re-herniation rate is 15, 20, 25%. Different data
And
shows.
I would guess that would also lead to other injuries because you're compensating for.
It could. So
Absolutely.
not only removing disc, the problem that the surgeons have had for 80 years that they've been doing discectomies is a lot of times they'll go in and do a discectomy and they'll take a lot of the disc out, the native tissue out, so that it doesn't squeeze back out the hole that's there and left to re-herniate and cause the symptoms again. So they take a lot of it out so it doesn't re-herniate, right? So they have to be a little more aggressive than they typically want to be.
Yeah, nobody wants that.
Nobody wants that because that healthy tissue in people our age, 40, 50, 60, 70-year-olds, 20-year-olds, they have healthy disc. They don't want to hopefully have a diffusion down the road.
Yeah.
So a device was developed by a guy, Greg Lambrecht. His mom reherniated L4-5 and L5-1. A few months later, reherniated. This was his mom, reherniated through the same levels, became addicted to opioids, had to have a 3-level fusion, and it was awful.
Wow.
So he came up with a better idea. In his garage, MIT trained.
There's nothing wrong with coming up with a good idea to help your mom.
That's right. We love moms. We love moms. Who do you think mom loves the most?
Huh? I'm gonna say
You're wrong.
they
I
stopped
asked her
having
this.
they stopped having kids after me.
Yeah,
I'm
but
just
I
saying.
asked her this. What is the percentage of love that she has for me versus you guys?
No, in actuality, as the firstborn,
Oh, God.
it's fair to say that I was most wanted, and then you guys were a surprise.
She has called me an accident. She said you're an accident when you were a surprise.
Firstborn, have you heard of the saying? It goes, if at first you don't succeed.
Try again.
Oh, that's right. try.
That's your real laugh, right? It's like a sound effect laugh.
Oh, okay.
Seriously.
Yeah.
It was like a ringtone laugh.
It's a really...
Can we at least agree that it wasn't Mike? Because if it was first, it was you. It was last, it was me. It definitely wasn't Mike.
Yeah, you're in the middle. You're the jelly.
Like if you were the best, why would she have me?
You're the jelly.
Well, she had us together.
You're the jelly. You're herniated.
I don't really know that analogy, but anyway, let's get back on point.
Back on point.
Back on point. So we have someone who had a herniation, they had pain, they had a re-herniation,
Yep.
they got addicted to opioids or narcotics.
Yep.
Narcotics are bad for you.
Yep.
And so the son said, I'm going to do something to help not only my mom, but to help society.
That's right. So he came up with a product and a company called Intrinsic Therapeutics, and the product's called Barricade.
Now,
And it
real
does-
quick, you said he was trained at MIT?
Yeah.
So he's not a doctor.
No,
How did he learn how
he's
to?
an inventor. He's
He's
an
an
engineer by
he's an
trade.
engineer,
Yeah,
okay.
right. So he came up with a little device that actually goes into one of the bones, so it's bone anchored. It's not going to go in there, and it kind of goes in to the disc part and opens up like a catcher's mitt. So now it's occluding or closing that hole from within, so the disc can't re-herniate through that hole.
Like a balloon.
Just like that. So it looks like a catcher's mitt. So now the disc can't get back out. This is the disc. So it now can't go back out that same hole that was there. And the data shows that with a barricade in you are it prevents reoperation or reherniation by 81%. This has been around, FDA approved in 2020. I think there's 12,000 patients that have been done so far. Great results. And it certainly is one option if the conservative therapy doesn't work.
Okay, good. And how long does this surgery take? Is it painful? Does it take like months to recover? What's the prognosis?
So a normal discectomy without barricade is going to take about 45 minutes to an hour. Small incisions. Some surgeons will use a little tube they look through. Some people use a little mini open. With the barricades, usually average an additional 5 to 7 minutes of time. Pretty simple in procedure. These are all neurosurgeons, orthopedic spine surgeons that do this. They're trained. They've all done several thousand.
You get that into somebody's back laparoscopically?
Not yet. Great question, but not right yet. Not yet. They're working on that. Good question.
Yeah, that's a good question.
Thanks.
Good job.
Yeah, appreciate it.
And what's
Not just a pretty face.
what's the recovery time?
So the recovery time is the exact same with the discectomy. There is no added recovery time with the barricade.
So it's not overnight?
Not overnight.
So it's
a day surgery.
outpatient?
Outpatient.
And then they have limited activity for a week or two?
Typically, most surgeons' cadence of the way they give a post-op care will say, with a normal discectomy, will say no BLTs, no bending, lifting, twisting for 6 weeks. We're seeing surgeons around the country that are limiting that, lowering that to maybe 3 or 4 weeks. Some surgeons are going, hey, I want you healthy right away the very next day. Some doctors are keeping the 6 weeks. It's all dependent on their experience. Some of the more experienced surgeons in Texas, San Antonio, and Austin, and around the country have really tried to, back to your original thought of getting up, getting mobile, and working, and causing a cardiovascular relief to blood flow supply to start healing. I've really encouraged their patients to get it quicker.
Okay, good. So what are the main risk factors? Or what's your incidence of complications with this surgery?
So our level 1 data shows of the...
Level 1 data, what does that mean?
Well, it's a certain type of study in the way it's
like
produced.
The highest level
It's the highest level of qualified research that can be done for a company. And that data shows that the incident rate is less than 2%. Typically, it's really 1.4%, something like that. But it's less than 2%. Very, very safe procedure. As in any other procedure that you do, a fusion or things like that, really the exclusion criteria is just a patient that's morbidly obese. If their bones can't handle an implant or a device, then it probably wouldn't be recommended. Or if they have osteopenia or porotic and their bones just quality is not good to be able to handle.
Osteopenia meaning weak bones.
Weak bone, or osteoporosis meaning really weak.
And your 1.47 whatever ratio complication is minor complications. What is your risk factors for significant complications? Do you know percentage for that?
It's less than 2%.
It's got to be way less than 1.4%.
It's way less than, I want to say it's 0.03%, right. But don't quote me on that. I'd have to get that to you. We'll edit that out.
Which comes to my point for the patients to know is don't confuse possibility with probability. Certainly it's possible that you have a complication with any surgery, even procedures, but don't confuse the probability of something that's very, very low likelihood to have a minor complication at 1.4%, much less a significant complication of 0.03%. That's why you go and talk to your surgeon so they can explain this and answer your questions and see if you're a good candidate for this procedure, the barricade block, to prevent re-herniations.
You're a lot smarter than you look. I'm impressed.
I think you're just as smart as you look.
That's a good one, Dr. Moran.
Who do you think Mom thinks is
Yes,
smart?
he thought it was a compliment.
What are you laughing about?
You wouldn't understand. I'm sorry. But you look great for 75.
Just for me.
There you go. All right. Did you guys have something to tell all our viewers about what you kind of want to know about teaching and what they can do to help support teachers and help the kids optimize their education?
So statistically, this may sound a little unbelievable, but 60% of fourth graders in this country are not reading on grade level. 60%. And in Texas, it's 52%. Then when you factor in the economically disadvantaged population, it goes up to 62%. Mm-hmm. If there's any, and I understand we're in a situation where most of the time both parents work and people are struggling to get by. If there's anything that data and research shows can help your kids the most, it's for them to read. It's for them to practice reading with you, and if that means various types of programs, phonics, what have you, so be it. If they don't have on-grade level skills, reading-wise, by the time they're in third grade, the chances of them ending up in jail or in having a life of poverty are 70%.
Yeah.
The state of Texas actually projects building jails based on third grade STAR scores.
No, I didn't know that.
Interesting.
So clearly we need to make sure that our parents are being active participants with their kids' education. So reading 15 minutes a night or 20 minutes a night, or actually involve them in making sure that they're talking to them and
Take
take
the
it.
phone out of their hands and have them read.
So reading is very important, because if you can read to do anything. So you got to learn how to read. So very good message. And what did you have to say to our viewers about things they can do to help understand, or so what are some common questions that you get where patients say, well, I don't want to do this or this? What would you tell them if you had an opportunity to speak to all of them?
I would personally say, and thanks again for having us, Dr. Moran. I would say personally, I would personally say, I don't want anybody out there to have a barricade. I don't want you to have a herniation. And that's something that you totally can control yourself, right? It gets back to what we were talking about with low back pain and being an active participant instead of passive recipient. It gets back to talking about sedentary lifestyle. It gets back to talking about sitting at a desk, sitting at home, sitting on the couch when you're there for 3 hours watching TV. I don't want you to have a barricade. I don't. And you can control that, right? Control your controllables. We all have options. We can live tensional with the way we choose to do.
Ooh, good plug for your book.
Thank you for that.
Good plug.
Right? Take the teacher time for yourself, right? You don't want one of these. You don't want procedures. You don't want back pain. And if you have it, you can help that. You can help it now. We've got N of 1 right here looking, right? Back pain, a little overweight. He had an aha moment and he's changed his life, and we're so proud of him for it, right? So take control of your life. Take some teacher time. You deserve it because your family deserves it.
I have 2 more questions for you guys. And I'm pretty sure you guys will get them, but we're going to find out.
All right.
Who said this quote?
Where's the Churchill?
The battle is won before stepping foot on the battlefield.
Douglas MacArthur. Sun Tzu.
Lincoln.
Sun Tzu.
Tzu. I couldn't pronounce it.
Sun Tzu said this.
I'll give you that one.
Sun Tzu was well known for being a great warrior, a great leader of men many, many centuries ago. And he wrote a book called The Art of War.
Right.
And in The Art of War, that's one of the things he said. But it's not really just about war. It's about life.
Right. Correct. So Sun Tzu was a Chinese philosopher who lived around 500 BC, so 3,000 years ago.
You sure he wasn't a warrior?
He was a warrior
Okay.
and a general and a military strategist.
All right.
But he wrote this book, The Art of War, which is still used today because the principles he put in it 3,000 years ago are still very applicable today. One of which being the battle is won before stepping foot on the battlefield. Next quote. Who said this? If you fail to prepare, prepare to fail.
I'm going to go Lee Iacocca.
That is incorrect.
Okay.
That is totally out of your
Well, I
butt.
thought it was a good guess.
No. Fail to prepare to fail.
I'm going to go.
I want to say Winston Churchill.
I'm going to go. Is it a president?
It is.
Ooh.
No, it wasn't a president.
Oh, okay.
He was a famous statesman.
You're leaning towards what I said, aren't you?
Yeah, well, it's totally. I'm going to go with Bill Russell.
It was Ben Franklin.
I was close.
Ben Franklin.
I knew it was a B that was coming to me. Yeah.
Yeah.
Franklin said, one of my favorite quotes of all time is, if you are failing to prepare,
And
you
he
are
invented the Franklin
preparing.
stove.
You are preparing to fail. So think about that. We've talked about this for an hour now. We are telling people what is going to happen if they don't invest in their kids' education.
I have one.
If they don't invest in their own health, if they don't take care of back pain. We are telling them right now, if you fail to prepare, you are preparing to fail, and you're going to need this information.
Live tensional.
Live tensional, right?
Since I keep bringing up Winston Churchill said, those who never change their minds never change anything, which also applies in this situation.
Right. So we are trying to help our community, our society, our friends and family to be healthy, happy people, and that's going to take some investment. Have you guys ever improved anything without investing time?
Nope.
No.
No. If you want to improve something, you have to invest time. So, viewers, we appreciate you. We love you. We want you to be happy and healthy and productive and prevent these problems. So, invest some time in yourself. Take the oxygen, put it on yourself so you can help others. And we hope you enjoyed the show. Please call us with any questions or email me. We are happy to help out.